Hi, guys, and welcome back to Disgustingly Easy, the podcast for the long game. So, this is a space where we talk about strength, identity, what it actually looks like to build a body and a life that work for you for the long term. No quick fix bullshit, no surface level stuff, the deeper conversations underneath it all, because that's where the change happens. And today's episode is one I have been so looking forward to. I'm joined by Dr. Caity Hanover, who many of you might know online as the Barbell Osteo. Now, if you don't know, Caity is an osteo, a strength coach, a gym owner, a business mentor who is doing some really interesting work in the intersection of rehabilitation, strength training, and how we understand pain in our bodies. What I really appreciate about Caity is the way that she's not afraid to ask questions of the assumptions that sit inside the health and fitness industry, things like what treatment is supposed to look like, what recovery is supposed to look like, and even what we believe health is meant to look like on women's bodies. So she talks openly about moving away from more traditional hands-on approaches that people often associate with osteopathy and instead focusing on education, strength, and helping people build capacity in their bodies rather than constantly just trying to fix them. And if you followed either of us for a while, you'll know we both share some pretty strong views around women's bodies, the cultural obsession with thinness, and the strange moment we're currently living through where medication, aesthetics, and health messaging are all getting tangled up together. So today we're going to talk about Caity's path into osteopathy, what it looks like to run both a clinic and a gym and a business mentorship, why she practices differently to many physical therapists. And we're going to zoom out for a little bit and also talk about women's bodies and the cultural moment we're in right now. So Caity, welcome to Disgustingly Easy.
Thank you so much for having me. I'm so excited to be here, and that intro was incredible. I feel very humbled. Thank you.
So I would love to start by asking you to, I guess, if people haven't heard of you before, who you are and what you do.
Okay, so the way I see my work now is it's very much in the education and empowerment space. I'm particularly passionate about working with women and helping them understand their bodies and themselves better using the vehicle of strength training, specifically Olympic weightlifting, which is what my gym is focused on. But I work with women in all stages of their strength journey who have had maybe persistent or reoccurring pain, who have lost connection with their bodies, who have gone through injury or maybe even are in postpartum and are learning to understand themselves, reconnect with themselves, and exploring what strength training looks like for them, but also helping them understand that an injury or pain that they're living through doesn't have to impact their life forever. They don't have to rely on someone to fix them, and that with education, they can feel empowered to take action and move forward and, achieve their own individual goals. So that's kind of where I'm at now. It's come from a place of being an athlete myself, navigating lots of serious injury, feeling very dependent on a health system that I didn't understand, and thinking that if I just found the right person, they would fix me and my pain would go away. And what I have come to understand now is that every single individual has that capacity within themselves with the right guidance from a practitioner or professional, and that I had just gone through this process of outsourcing my power everywhere else. And once I realized that that power was within me and had the tools to uncover it, my pain and my life and my health got a lot more positive.
In this work, do you feel like one of the things that startled me when I first got into the fitness industry, because obviously I started in social work and then I moved across wanting to help people in a more, hands-on capacity, the literacy that we have around our bodies, the fact that our bodies are, like, as Stacey Sims says, we're not small men, what we understand as how they function, why we're getting certain messages or information, that might be pain, that might be a certain symptom. Women's literacy around their bodies and what they're experiencing is incredibly low.
Incredibly low.
But
Yeah.
how do you see that reflected, I guess, in the work that you do? If someone's new coming to your gym, what is often some common understandings that they have around their body?
I think there has never been a moment for a lot of women that I work with where they're taught to look inward and connect to themselves. So it's like all of this messaging they've absorbed of how they feel they should look, how they think they should train, what success looks like for them. And they haven't actually really stopped and connected with what do they want for themselves? What are the options? What does that look like? So it's exploring that in a way that is, I guess, open and flexible. They can change their mind and they can figure out what movement feels good for them. I think like speaking of Stacey Sims, she obviously talks so much about the importance of strength training for women. And what is so interesting to me is so many women that I work with now always believe strength training wasn't for them.
Mm.
They always felt like, no, that's not what women do. That's not how we express our bodies. Like, I can't use that weight because I'm going to get bulky, and all these other narratives that they've maybe absorbed. And honestly, the transformation that I get to witness with them coming in, feeling a certain way about training with weights, and then leaving, 8, 12 months later with a completely different relationship with training, but also themselves. I really feel like the barbell is like a vehicle for so many different opportunities for growth and expression that women don't even realize is there. So once they tap into that, it can be transformational, obviously in the gym, but more so outside of the gym with how they show up in their communities, in their families, for themselves.
Yeah, absolutely. And I think one of the problems, like when you talk to women needing to look inwards and like, what do I actually want from this? So many of us have had our desires co-opted by the cultural conditioning around thinness and needing to be thin or looking a certain way or appealing to the male gaze. I feel like so many women don't realize how the cookie cutter approach, going and doing a challenge that tells you what to eat, when to work out, and what to do exactly, is never going to be a successful way to, it's never going to make you happy. I was going to say it's never going to help you meet your goals, but when people are starting, I would hazard to say that you would agree with me. When people are starting, they do not actually know what their goals are.
No. They think that they need to lose 10 kilos because that is what they hear and that is what society tells them. And it's like one of the conversations we have often in my gym is all around like performance and outcome based goals.
Mhm.
And we really don't have the body composition challenge conversation very often. And it's not because we don't understand that that is a goal for some women, and we totally respect that, but it's more that focusing on the outcome of feeling strong, squatting 50 kilos for the first time, being able to push a weight over their head, that more often helps them feel so much more empowered in their skin that the arbitrary goals that are maybe pressed on us by society, like weigh X amount or lose this many kilos, no longer fill their heads up. Like it's not as much of a focus because they're starting to feel strong. They're starting to
Mm.
feel capable. They're noticing the change in their energy. They're noticing the change in their mental health. So I think like shifting the focus onto performance for us specifically has always been so empowering for our community.
Mm. It's letting that voice that speaks to all the ways they feel good get louder than the
Mm,
voice that's like, I just need to lose 10 kilos. And I even had the conversation recently with a woman inside the long game where she said, oh, I think I probably need to lose about 15 kilos. And I had a look at her stats and she weighs 86 kilos and she's the same height as me. And so I just reflected back to her. I was like, mate, I actually had very similar goals, especially when I started back on my postpartum journey, was like getting down to 70 because I knew and understood 70 to be, that's kind of where I've sat in the past. And I reflected back to her, like, I'm your height and I'm 6 kilos lighter than you. So, like, that's taking into account, muscle weighs more than fat. And, we don't necessarily need to be aiming for what we had in our 20s. Our body is supposed to grow, change, and evolve. What I would love to go to now is just how did you get, I mean, you spoke briefly to your experiences with pain,
mhm.
but was that the lead into osteopathy and working in fitness?
I was working in fitness all throughout my degree. So I have always been a super athletic human. I was an elite gymnast as a kid, and then I played a bunch of different sports. And I effectively found CrossFit when I was in my late teens, early 20s. So you can imagine like super high intensity, lots of comparison. Where I was probably wasn't the healthiest gym environment either. So I went in hard. I was like double day training. I was 7 days a week. I was fully drinking the Kool-Aid. So with that came injury almost immediately. I was living in
Same.
the I was living in the UK at the time and had a really poor understanding. Even though I was like passionate about my body, I didn't know what pain meant. So
Mm.
I just felt like as soon as my body was sore, there was a big concern. I was very, very scared and I went and sought help immediately. And the help that I got sounded like, if you keep training like this, you will need a hip replacement by the time you're 30. My grandma, will be able to walk better than you if you keep training like this. Just all of these scary, scary narratives. And I was terrified. So I kept trying to like almost health professional shop around to find the person that could help me, because no one was giving me the answer that I sought, which was, you can keep training, but you need to change X, Y, or Z. So I eventually ended up having to have a few pretty invasive procedures on my hips. And I found this osteopath in the UK who was really helpful. He was the first person that looked at me squat. He was the first person that actually was like, okay, can you see how your hips are doing this? This is why you're getting pain. If we do this, this, and this, you're going to feel better. So I started to see light at the end of the tunnel. And I was like, I don't know what this osteopathy thing is, but I want to do it. So I applied to uni whilst I was living in London. I was a PT and a CrossFit coach at that time, and I'd been doing that for 4 or so years. And then I moved back to Melbourne to do my degree. So I moved back to Melbourne. I was studying osteo, which is a 5-year degree, and I was effectively coaching the whole way through my degree. So I was coaching Olympic lifting and CrossFit at the time, and then basically studying as much as I could to try to understand pain in the body. They definitely they work well together because they're very much like, two branches of the same tree. However, I still very much felt during my osteo degree that having hands-on care and manual therapy was the path that I was going to go down, because I thought that if I could just find the right person, or I could become the right person, I would be able to help all these people with their pain. And it was still very much the doctor mentality of I will fix you versus I can help you fix yourself, or together we can make a plan that is going to help you progress forward. So that period of my life, I was still really looking to find a magic doctor while studying myself to become a magic doctor. I eventually kind of hit my 5th year of my degree. And over the summer break, I was reading a lot of journal articles. I went down a bit of a rabbit hole, very, very much around manual therapy. So manual therapy, effectively like massage, manipulation, dry needling, things like that. And I started to realize that from the research, almost none of the effects of manual therapy that we had assumed were down to the therapy itself were actually proven to be effective. So a lot of what was happening was what we call pain modulation, which is impacting the nervous system to dampen the pain response, but the actual tissue structure doesn't change. So you're not breaking up adhesions, you're not undoing tight muscles, you're not softening knots, you're not putting bones back into place. And as a 5th year, almost graduate osteopath, my head exploded. And I just went into this complete identity crisis because I had just spent 5 years learning all of these wonderful things I could do with my hands. I could crack any joint in your body. And I had thought that that would make me a worthwhile and helpful osteopath, and I could help the people that I wanted to help. And then I realized that that all was not true. So I had to figure out what did my version of healthcare look like. And through a bit of trial and error and my very heavy bias on exercise, I realized that if I could teach someone to move better, I could teach someone to mobilize different areas of restriction, all whilst empowering them to strength train, take better care of their health, manage their stress better, look at the big picture better, that would be effectively my version of osteopathy. So that's kind of where I landed, and that's kind of how things have progressed for the last almost 8 years.
Yeah, it's so interesting to hear, because my experience with pain postpartum, I was very similar journey in terms of CrossFit, going hard, using it to make up for any other areas of my life that I wasn't feeling good in. I could go and channel it all into CrossFit, and constantly experiencing pain, especially as someone who I now would classify myself as hypermobile, and, whether or not I sit on the Ehlers-Danlos spectrum, or whether that's a diagnosis that I'll get in the future, has been something that's been suggested to me. But I was constantly hurting myself, and having professionals it was almost as if they were putting it, I felt like it was my fault that what they were doing wasn't working. They would come and they would do manipulations, or they would do massage, or they would do all kinds of things. And obviously it feels good at the time. It feels good to have someone massage your muscles. And especially postpartum, I had a chiropractor say to me, I kept coming in, 2 months postpartum, 4 months postpartum, 8 months postpartum, being my hips, I was in a place where if I lay on my back and did a hip bridge to lift my glutes off the floor, I could almost not get them off the floor because I was in so much pain. Just tensing those muscles around my sacroiliac joint was so painful. And his response, everything's explained in the fact that it was his response, was well women's bodies move and change postpartum. And it was just kind of like, you're a bit broken and you should just kind of expect this level of pain from now on. Whereas I was like waking up in the morning and log rolling out of bed onto the floor, trying to do a few cat cows because my hips were in so much pain. And every single professional I went to was like, this should work, which maybe even more compounded by the fact that I'm autistic, being like, oh, okay, I'll do my best to make sure that what you did works. And it wasn't until I finally, like after 5 or 6 false starts over 2 years postpartum, got back into the gym, started working on my core strength and getting mobility back through my hips and strengthening my glutes, which were probably quite inactive and weak, that the pain, there was almost a moment where it was like 100% better. Just one day I woke up and it was just gone. And I was so frustrated because I'd even gone down the path. I'd seen osteos, I'd seen myos, I'd seen chiros, and I went to a physio and she was like, okay, well, I think it's time, like everything you're explaining to me, let's get some ultrasounds and start talking about surgery. And I was so pissed off when I finally like woke up one day, almost completely pain free, can lift my kid. I was like, you guys were talking to me about surgery and I just needed to go do some fucking squats.
Yeah.
Like at this point, I was doing, from someone who had previously done, for people who know what this is, you'll know if you don't, like an 80-kilo clean and jerk. Like that was my like peak
Mm,
CrossFit,
mm,
to like being in the gym, trying to recover from having a baby. And I've got like 4-kilo dumbbells and I'm
yeah.
doing squats.
Yeah.
And that was enough. Like, I couldn't believe that that was enough to heal the issues I was having when
Mm.
I had qualified professionals telling me I needed surgery.
And that story is so common and it's so unfortunate, but it's so common. And I think that is why I have found like my little pocket in the industry because there's so many people that come to me and I'm like practitioner number 10. And
Mm.
I'll be like, who sent you? And they're like, my friend blah, blah told me you're some weird witch lady who's going to make me do these funny little drills, but then I will feel better. And
Mhm.
I'm like, that's a really good summary of what we're going to do here. And there is still people that come in that maybe expect conventional osteopathy. But when I always like position what I've seen, the assessment findings, and what I think is going to be the fastest road to recovery, like 99% of the time, they're like, I'll do anything. I will do the glute bridges. I will do the plank, like whatever it is that you feel I need. I'm so here for that because people don't want to just lay on the treatment table and have someone's elbow in their hip. They want to feel better. And as
I'll just
soon
go get
as
a
we
massage if that's what I want. Like,
yeah. And as soon as I can frame it as like, look, this is something that I can do to you today where you'll feel better for maybe 5 days, or this is something I can teach you to do for yourself. And you will hopefully feel better for the rest of your life. And you always have this skill. So if
mhm.
this ever happens again and you've ever got the same area of discomfort, let's go back to these rehab exercises and revisit. And often I have patients all the time that I haven't seen for, periods of time where they'll message me and say, my back flared up again, but I was so grateful for you. I went and did X, Y, and Z like we did last time. I've recovered so much faster. I feel almost back to normal 3 days later. And they have those skills. They don't need to book an appointment with me and frantically be on my waiting list. They go back to the things that we have that I've helped educate them on from day one. And that is what I'm passionate about because I think in the health industry, there's this like practitioner mindset of keep coming back, keep checking in, keep having maintenance appointments. I'll keep you feeling well. And it's like, why should we put ourselves on a pedestal? Like, I don't know your body any better than you do, but I can help guide you so that you can then take control of it and be empowered in your own health and your own kind of like recovery.
This is why I love connecting with practitioners and experts and just women like you, because I was just scribbling notes frantically of like, don't forget that this is what I want to say. This is like a representation of a matriarchal application of care because this is community based. This is like empowering. This is anti capitalist because it's like, I'm not going to convince you. I've had this so many times and I love when I see you talk about it on socials. I'm going to convince you that I am the savior. I am the antidote to your pain. So you need to keep coming back to me and paying me. It's anti like paternalistic because it's like that stand over, that top down, that I'm the parent and you are the the child and I am the one in control and I'm the one who tells you what works and what doesn't. And it's also like anti-patriarchal because it's actually like centering the knowledge not in expert and client or doctor and client. It's community-based care. It's like, how can we all work on this together? So this to me is like the antidote to so many of the ills that we're seeing throughout women's bodies, women's experiences. And I love what you said about teaching people to do this themselves, because so much of what I used to see when I was on the gym floor was, this is just how my body is. This is just what happens. Even I remember very much when I started in group fitness, when I first got my Cert 3, I remember a woman saying, "Oh no, I can't skip." And I was like in my 20s at the time. And I was like, "Yeah, you can do it. You can do it." Like hyping her up. And she was like, "No, I can't skip." And me, still autistic, no understanding of nuance. I'm like, "Yeah, yeah, you can." And she was like, "No, I'll wet my pants." And I was like, "Oh." And at that point, not having had any children, I was like, is that just the norm? Like, is that just the norm? And I think so many women think it literally is the norm and you should just accept that
Yeah.
forever.
Yep. And just stop exercising in the way that you desire because now you've had a child. So your needs are no longer
Sorry.
at the front and center of like the reality. And I have this conversation with women postpartum so often, and I'll say, okay, so, baby's had all of these checks, and that's super important for their health. What have you had?
Yeah.
And they're like, oh, I'm 2 years postpartum, and this is the first appointment I've had for my pain. And I'm like, okay, cool. Like, I'm so glad you're here. But why is it not normalized that we're having those conversations earlier?
Mm.
Why is it not normalized, particularly if there has been some kind of trauma during birth, that there is not a check that happens with mum as well? And it's not just okay, you're clear. What does that mean? Like,
Yeah.
let's actually give you some structured, tangible protocols so it understands what exercise re-entry looks like. So you feel empowered and you know how to change and pivot and have guidance on these things.
I remember being told 6 weeks postpartum that I was clear to exercise and clear to have sex. And I remember my first thought being like, fuck any of that 6 weeks postpartum after like a very happy, successful vaginal delivery, no
Mm,
tearing, no prolapse, no nothing. But past that 6 week check, I remember having seen fitness influencers, women with potentially more resources and more capacity or not neurodivergent,
mm,
going back and exercising. And that was part of the reason why I think I was stuck for that 2 years, was like, I'm not doing it right. I should be at this level, but I'm still experiencing so much pain. Even just the ways in which you know, we know too much about everyone's lives now. So it's like, I didn't do it how she's doing it. I'm supposed to be following this timeline. How do you see the comparison for women, keeping them stuck or keeping them in a cycle of not reaching their goals because they're striving for something that's actually got nothing to do with them?
think it plays out so differently for so many women. But I think it's just this unfortunate current societal obsession with looking outwards once again. So it's like looking at her and either pedestaling her or shaming her and, not being able to understand that it's okay to ask for help and having really clear pathways for those resources, whether they are, even just friendship circles, like having the support around you, the community based conversation of you've just gone through X, Y, or Z, whether it be birth, whether it just be injury. Like, what are the protocols and the things that we need to be putting in place to make sure that you are taking care of yourself and not externalizing the feelings that you've got about where you're at so that you end up, either isolated and staying stuck because you don't know the first step forward. Or like I do see sometimes, unfortunately, like people making other people wrong for their journey because we all know everything about everybody else, but
Mhm.
we also don't know the context of what's the true lived experience. We just see, the highlight reels of all these things. And I know of people that have monetized, let's say, the postpartum bounce back, which yeah, it's giving me that. I got goosebumps having to say that.
Yeah.
But it's like, and there's levels of fraud with the actual
Information.
content and the information and the content. Even like, I'm not even going to divulge, but effectively people that knew they were going to get pregnant had a plan to use the bounce back as a way to make money using content pre-pregnancy in the similar outfits trying to say that they were, 8 weeks post. So the
That is
fitness
so
industry,
unethical.
yeah, the fitness industry is unfortunately so unregulated, so that there are so many people out there just trying to make a buck and not really realizing how that can influence so many people down the chain.
I struggle so much with one of the things that I find really difficult in the way I market is on the one hand, knowing how much weight loss sells and how you can get people in and you can support them in that context or coming from that context to reshape their desires and their identity, what they're looking for and what they think is healthy. And I also really want to neutralize everything I talk about. So I see people kind of going one way or the other, like online coaches especially are either very weight loss heavy and you've got your Sam Woods 28-day
Mm,
where they advertise literally on their website, this woman lost 16 kilos in 8 weeks, which obviously I have such a huge issue with because I don't think anyone should
yeah.
lose that amount of weight in that amount of time, nor should you advertise that that's the norm. Or I see them go so far the other way. Like we've got, I really like the Kick brand and the way they don't talk about the scales. They don't do challenges. Anything that they do is quite strength and community based and community focused, albeit it's run by two models who always look incredibly stunning, which is sometimes hard for me to come to terms with as well. So I've always tried to sit in this middle place where it's like total neutrality. Like you can want to lose weight. We're going to look at the reasons that you want to do that. But also if that's not what you want to do and not what you want to focus on, we can look at other things. But it's about not being afraid of any part of it, not being afraid of the scales, not being afraid of measuring yourself, just coming to it. Like I hate body positivity because there's a good, there's a bad. If there's a positive, there's a negative. Just body neutrality for me was kind of what saved me in my eating disorder days, in my very dysfunctional days. Because in the end, it's like, it's just a body. It's
Yeah.
the vehicle through which you're going to experience life. And I think I saw a stat yesterday or the day before, women spend up to 30 years of their life dieting, 30 years
Yeah.
worrying about
Yeah.
how you look, what you're eating, if you're doing it right. And like, what
Mm,
a waste of time.
yeah. And I think like to throw in another layer of complexity for my specific gym community is Olympic weightlifting is a weight class based sport.
Mm,
So we have the added layer of you have to weigh. You have to stand up on a stage in a leotard effectively and, do the heaviest lift maybe of your life. So there's this extra layer of, okay, now there's this conversation around weight all the time. And as an athlete myself, there was so much commentary on if I was heavier than I should have been, if I was lighter than I should have been, what my fueling was like. And even when you're a performance based person based off your sporting desires, that still lands for you. If you have a coach, and in this instance for me, it was a male coach, telling you looked like you'd put on a few kilos over the summer, you can logically be like, okay, I'm outside of my weight class zone, so I need to, change that if I want to compete, or I need to reassess my weight class choice. But having someone like give you that information in such a like cold, non-balanced way lands as a young woman or woman of any age who's like trying their best to just focus on performance. Because for me, focusing on performance was my saving grace from
mm,
the extra stress of being a young woman in society. I
mm.
was able to say, okay, I can lift 150 kilos, therefore I feel worthy. And that's got its own set of problems, don't get me wrong. But for me, my fixation was on performance and data that way. It wasn't on, I must weigh this. So that was helpful in some ways, but it also has colored, I guess, the way I coach now with the women that I work with, because we talk very much about performance, but that conversation around body weight has to be handled with so much delicacy.
Yeah. And I think not having had the experience that women have growing up, a male coach, there is just layers to that and context that they cannot connect with. I want to come back to the idea of being performance based because I really love this as a conversation for the general population. Most women who come into strength and fitness or strength training or any kind of program have never considered themselves as someone who could be a performance based athlete. However, I'm so on the same page with you about the fact that when we shift our perspective or shift our focus from how do I look to how do I perform, that makes a huge change. How do you navigate those conversations with people who are like, that's not me, that's not who I am, I'm not an athlete? Because re-understanding or recontextualizing your experience in that lane is incredibly helpful.
Yes. I always try to come back to why is that person seeking help right now in our space? So what is it about us or me that's helped? Like, why now? Why me? What is it that you feel I can help you achieve? And there's always a layer to that. So I guess it can be whether it is lose 5 kilos or squat my body weight, there is always a reason why. What is it? And for so many people, it's like, I want to age with strength and function. Like I saw my mom stooped over and frail at the age of 80. I don't want to be that person. Or, I want to be able to pick my kid up without pain, or I want to be able to run with my teenager and, kick the footy ball and those sorts of things. So I try to always bring it back to a deeper layer of where is your desire coming from? Because even if it is performance based, it is not enough to say, I want to clean and jerk 100 kilos. Why? What is that going to give you? So coming back to values, coming back to identity, that is where we really tend to start. And that helps us then create like a long-term plan with the like short-term habits that we're trying to implement to get you there. So I really like the be, do, have model, and I use that a lot to try to, who do you have to be to do the things you want to do so you can have the outcome that you desire? Because people start with the have. Like I want to have 100 kilo squat. What does that person do every single day? Do they, make sure they're fueled before their sessions? Do they make sure they're scrolling or they're sleeping? Like there are choices throughout your day that you have to make, and being able to link that performance-based goal to that little steps that you must take each day or each moment when there's a hard choice in front of you can really anchor them into being able to look long term whilst making those more aligned choices in the short term.
Yeah, I love that. I don't think I'd heard "They Do Have" before, but it's so funny how that directly parallels the focus framework that we use inside Long Game, which
Mhm.
is habits, confidence, strength. And so people come in thinking that if you want an aesthetic goal, or if you have an aesthetic goal, they don't understand how much you need to be in the strength focus to achieve that. You need to be lifting at a certain weight. You need to be strong in terms of your decision making, your choices, your education, your understanding around nutrition. You need to be able to be like competent at all the moves that you're going to do. That's how you get the body composition changes or the aesthetic goals. Can't get that, the strength, without the confidence, because you need to know what you're doing. You need to experiment. You need to feel what it feels like the first time you dump a barbell or you drop something or you can't do a lift. You need to be able to be doing your bench press and fail and know and feel confident to manage that situation. And you can't be confident until you got the habit, because without the habit, you can't build the confidence. Without the confidence, you can't build the strength. And without the strength, you can't get the goals that you've got or that you say you want. So, in my most recent interview that I did with Forward Moves last week, Kira, who was one of the interviewers, asked me if I'd seen this reel online. And I wanted to mention it to you because I don't know if you've seen it, of a woman teaching how to put the weights on your barbell in a more ladylike fashion. As we know, on a very visceral level, as women who've spent years being told that our goal is to be smaller, how does it make you feel when you see even a strength coach falling prey to that kind of, it's always for the male gaze and that kind of thinking, and then teaching that.
Oh, honestly, it makes me angry. Ah, gyms historically are already places women don't feel comfortable.
Mm,
Women, like I sometimes drop into a gym in the city with my husband. He's a member there. And every time I do a drop in, I get a follow up call asking me if they'd like me to join into their Pilates class next week. And it makes me angry every time I get the follow up call because there is this assumption that I will not be in the weight area. There is
mm,
this assumption that my time is best spent on the treadmill. And I already feel like gyms are never constructed in a way to make women feel comfortable. Even when there is women's only spaces, there's pink dumbbells and 5 kilo weights. There's not this actual, it feels like no one's taking us seriously. So to then have a female strength coach suggesting that, you load your bar in a certain etiquette or a certain manner to make the men in the space or whatever feel comfortable, it honestly makes me angry. So much of my work with women when they first enter my gym is teaching them to drop the barbell from over their head and make noise and take up space and not care if they grunt and not care if they sweat and not apologize for leaving sweaty butt cheeks on the seat, because that is not, you do not need to explain your existence here. You are welcome to show up, train hard, get sweaty, make noise, and be who you are. Yeah, just that in itself, that whole premise, as you can see, makes me feel very frustrated.
I had a member in long game once bring up the fact that she realized that because she'd been wearing her headphones, she didn't realize that she'd been making so much noise, and it prompted such a good conversation in the group around the idea that, like, why would you ever expect to be exerting yourself in a physical capacity and not be making noise? It's kind of like the idea of, like, oh, when you have sex, like, not making noise, when you have a baby, not making noise. Like, if you are pushing a heavy weight overhead, you are going to grunt a little bit. You're going to make noises. You're going to make sounds of exertion. And
Mm,
the sweaty butt cheeks. I make it my mission. And I know that, like, I've been messaging you about my lifts and my goals to get this 150-kilo deadlift.
mm,
I make it my mission to make as much noise as possible when I'm
yeah,
doing my deadlifts on the platform of,
yeah.
like, I grunt, I drop the weights, I take up space, I make sure that people around me, it's not, and it's so easy to look at that and be like, it's conceited. Well, this is what women think that people think. It's conceited. She's up herself. Look, she's trying to get people to look at her. She's making as much noise as she can.
Mm.
But part of it is how much I know that when someone shows up in a space as their authentic self, being who they are, being unashamed, it signals to every other person and to me, to every other woman in that space of, like, I didn't know I could do that. I didn't know that that was allowed. So, I mean, is your gym isn't women only?
It is not. It is always, always been heavily female dominated. So for the
Mm.
first like 3 years of being open, our ratio was 80-20. Our ratio now over the last couple of years on top of that has become closer to 60-40.
Mm.
But the most interesting thing for me as a female owner and female head coach is how few men wanted to learn from me for my first couple of years as a coach. Like I would be coaching on the Australian team. I represented Australia as an athlete. I have a doctorate in literal biomechanics and osteopathy. And yet you don't believe that my knowledge is of the same value as my male counterpart. So
Or even, like, I'm going to go learn from some unqualified gym bro on the internet rather than from a woman.
yes. And it used to really bother me. And I would talk a lot to the male clients I did have and say, why did you pick me? Like, I want to understand what was going on in your head. And what I realized is the male clients that I do have are very coachable, feminists themselves, and very open to just the most educated person is who they wanted, but they also wanted the person they could connect with. And that was me, because I think female coaches have an EQ that a lot of male coaches don't have. And when you're in a performance based sport that demands a lot from you, you don't need someone telling you to shut up and go harder. You need someone who's going to get down with you, sit next to you, and understand the struggles and the mindset pieces and all the other bits of the puzzle. Women just have those skills inherently more naturally. So I was lucky that I initially thought it was a problem, and then I realized that I was just doing a really good job of filtering the people that I didn't want to work with. And I was getting the men in my spaces are incredibly safe, incredibly valuable, and incredibly respectful. So I'm actually just grateful that I have 60-40 in my gym now, because I know the quality of people that train there is incredibly high. Yeah, it takes a whole lot of mental gymnastics to come to that landing point, because initially I made it about my worth and about my value and, maybe I shouldn't do this and maybe I wasn't qualified to do this because people didn't take me seriously. But once I realized that if I take myself seriously and I let my work speak for itself, like the people do come and the right people do come.
Yeah. And I think the older we get, the more we realize not being taken seriously by men is not actually something that we really need to worry about.
No, it's no longer a goal of mine.
I love this the way this segues into the conversation about business and having a business, because I think the thing that I realized in the last 12 months, niching so heavily into like neurodivergent millennial mums, many of whom have their own business, was you how much you showing up as who you are, what you do, and what's important to you, and being so specific and being so grounded in the exact kind of person that you want to serve, the way that is reflected back to you in the people that you attract is, I was going to say astounding, but it actually makes so much sense. But it has to be how we run our businesses, right? The second you show up in a way that is inauthentic and then you attract someone who appreciates whatever you're doing, it's misaligned. Do you feel like you've kind of graduated to a place where you are like your authentic self online?
I think I'm definitely landing closer to that in 2026. I think I realized in the last 6 months that I had been so focused on what I could do for others that there
Mm.
was not a lot of room for who I was or what I needed or what I cared about or what I was interested in. For me, I had not prioritized friendship in a way that was very like centered. For someone who loves connection and people, I had basically put all of that energy into serving my clients and none into myself. So a really big priority for me was reconnecting with, like-minded women, creating time and space for those relationships. And I think that in itself has helped me feel safer to be myself online because I always felt that I had to be providing value and I had to be serving and I had to be showing up with something intellectual or interesting to say. And now I'm in a space where it's just like, a lot of the connections I've built online aren't about pain science. They're about bulldogs or, like coffee or something else. Like it doesn't always have to be that deep. But I think just being able to withstand also the inevitable backlash that does happen. When you
Yeah.
have an opinion and you show up, there is going to be someone on the internet that disagrees with you. I've had a few like little viral moments where things have gotten quite heated, and that has taught me lessons about myself and about things that I don't need to carry forward. But I think if you show up online as close to your authentic self as you can with the right intentions, the right people will find you.
Yeah, I love that. I want to zoom out for a bit and talk about the cultural moment that women's bodies are having. You and I have very similar views on thinness being used as a metric of health or something that women should aspire to. And recently, I don't know if you've seen images come out. It was either it was some kind of awards ceremony or something, but images of Kelly Osbourne. Have you seen what she looks like at the moment? And I don't like to specifically point people out, so I use it simply as an example of what's happening across the spectrum. But this focus on thinness and to the point where like she's got temporal wastage. So if people don't understand what that is, that's like if you imagine this part either side of your eyes is concave and it goes from this bone up here to your cheekbone and it is concave. It is this level of thinness. It is emaciated thinness is what is now popular. How does that make you feel?
Every time I see those images, I look at it from a health and functionality lens. And I think, how are you going to stand up off the toilet? Yeah. Yeah. Like, how are you going to function as you age? Not only from a musculoskeletal standpoint, but from a like brain capacity standpoint. Like, we also know the links there is to, Alzheimer's and dementia and these things, and that is linked to both grip strength as well as muscle density.
Mm,
Not only are you
size of your
potentially
thighs.
yeah, not only are you putting yourself in a place where you may not be able to care for yourself as you age or your loved ones, but you also can't think, you can't function. You may lose the capacity to have like express your own personality because you lose the
Mm,
skills of language. So it's such a slippery slope. And I think that people don't understand what they're toying with, unfortunately, because they just feel like they are ticking a box externally of what looks on brand, on
mm,
fashion, whatever, rather than really understanding the ramifications. Once you go to those extremes, it's too late. I know that, I've had a recent moment with training Muay Thai. And for the last 12 months, I've been training Muay Thai and I started taking it quite seriously. And I spoke to my coach about the idea of doing an amateur fight. And because of my height, he said to me, how much do you weigh? I said 75 kilos. He said, you would need to lose 15 kilos. And I said, I have spent the last 35 years of my life building the muscles that I have. For me, that's just not possible because I
Was
know.
he saying that the weight class you'd be in at 75 means you'd be fighting much bigger people?
Yes, because of my height. I didn't make that very clear, but because I'm quite short, he was saying that to
You'll
be a
get your ass
75,
kicked.
you would, and in Muay Thai, you're kicking. Like
Yeah.
someone's leg is going to be whacking me in the head. So
Mm,
it was like, he's like, it's not safe for you to be fighting a much, much taller person. You would need to be fighting someone of your own height, and girls of your height weigh this. So you need
mm.
to have a serious think about whether that's something you would be prepared to do. And the first thing I thought of was this. Like, where's that going? Like, I have worked too hard
For
to,
anyone who's not watching this on YouTube, I just pointed to her giant biceps.
it's like, I have worked hard to feel strong and build muscle. I know muscle is the primary longevity organ. And if
Mhm.
I make choices now that are going to diminish that, like
Yeah.
I'm putting my future at risk. And
Yeah.
that's just not something I'm willing to do.
I mean, when I see the extreme thinness, and it's part of the reason I got off TikTok, apart from like all the political reasons to get off TikTok,
Mm,
but there's just so many women talking about thinness, talking about how if you want to be respected, just get skinny, or like, this is what I do when I start to get cravings, or here is how I've reframed feeling hungry so that I've trained my brain to think of it as something to aspire to or to feel good about. Like, it's truly well and truly fucked. But it reminds me a lot of the smoking arguments. Like, I don't know if you were ever someone who smoked. I was a cheeky durries girl in my early 20s, late teens, early 20s. And people would be like, oh, it gives you cancer. You shouldn't do that. But back then it was like, oh, whatever. Life is for living. YOLO. Like, we're all going to die anyway in this perspective. And so when I see people being so flippant with their health in terms of just prioritizing thinness, it reminds me of that. Because it's like, you can't care about your older self, your aging self, even the idea of like the liability or the burden you put on other people when you focus so highly and heavily on thinness. It's just, I mean, I don't want to say it's selfish, because it's a conditioned response. It is
yeah.
women trying to feel safe in this world by manipulating their bodies and their external presentation to fit and suit the metrics that we have culturally said is acceptable. But I see this bleed through into conversations about health, because I have a lot of friends who do Pilates, right? And anyone who knows or has seen my Instagram knows I shit on Pilates playfully a little bit.
Mm,
However, I do see the Pilates arms, or when women talk about a Pilates body, as like the new clean eats or the new orthorexic perspective. It's not strength. It's
no.
not contributing to bone density. And when you show me your skinny Pilates arms, like, to me, you're showing me your health liability.
Yeah. Yep. And literacy, unfortunately.
Someone says, but I got strong in Pilates. I could do this and now I can do this. I could do this move 5 times and now I can do it 10 times, or I can lift my kids, or I'm feeling a little bit better. What are they actually experiencing? And why is that not strength?
Feel like it's a combination of improved coordination. So, like from a neuromuscular standpoint, their brain has adapted, and the way that their nervous system speaks to their muscle to contract has potentially improved. So, in some ways, we could call that strength because it is better neurological conditioning.
Yeah, the mind muscle connection.
Sure. So, yes, we're step one. And I think of Pilates as like the gateway drug of exercise. We can
Mm,
start there, and then you get to a point where the resistance that is available to you is no longer going to challenge you.
mm,
So, one extra rep or 5 extra reps, you're actually not getting stronger. Potentially, you have better output, better capacity, better muscular endurance, but you don't have muscular strength, because to continue to progressively overload, we need more external load to be applied to you to create more force, which will then create, bone remodeling, muscular hypertrophy, better neurological signaling, all of these things that are then required for you to get stronger.
mhm.
If you start to just do more reps at the same weight, you've effectively plateaued. You're no longer making progress. And that is where I think of Pilates as, okay, we might do this for 6 months post serious injury to get you back to a place where you've built coordination, confidence, and a habit of moving your body. But then we need to intervene and say, okay, what is the next logical step that is going to help you continue to move forward?
Yeah. I see Pilates very much as like karate. Like, I love karate, and I'm never going to stop doing karate, but I wouldn't argue that karate is the reason that my shoulders pop, or the
Mm,
reason that I can lift heavy things. It's the thing that I do for fun. It challenges me mentally. It challenges my endurance. It challenges my cardiovascular fitness,
100%.
but it's not making me strong. Doing push-ups every time we get in trouble because we've messed something up or we haven't been respectful, that's not creating strength. That's like, it's a drop in the ocean when it comes to strength training. So, what do you think or what's your message, I guess, for women who are genuinely afraid of the barbell? Like, if there's someone who's listening to this going, well, I do Pilates, but I do want to focus on strength and I want to make that shift across into either a gym or a strength based environment, but that's not me. I've never done that before. I've never lifted things that are heavy. Maybe part of their identity is them being weak or small. And maybe it's something that they've always kind of felt. How do they make those first steps?
My first suggestion is always to seek aligned support. So, someone who you connect with has similar values to you and maybe has a similar story to you, who is able to almost be a few steps ahead of where you currently are. So, being able to have someone who has like walked that path, effectively, they can share their wisdom, they can share their expertise. And I think the other thing is like Pilates, probably, if that was your entry level, your first day there wasn't easy either. Like
Hmm.
you've already proven that you can do the new thing and you can do the hard thing. And you're not locked in. If you decide you want to play around with the barbell and you give it, let's say, 3 months of twice a week training, and you get to the end of it and say, "Do you know what, this isn't for me," maybe there's a discussion about an alternative type of strength training that you may do. But I think like you need to give it a shot and actually be open to the changes that it can help you make. But doing that with support ultimately is 100 times easier because someone else has done this before you and overcome this and, built a different life as a result of it.
Yeah. I have this kind of philosophy. You can take the time or you can spend the time or you can spend the money. So you can either spend the time working it out for yourself. Both avenues are a great idea, a great solution.
Mm,
You can spend the time or you can spend the money on finding a professional, and that is going to make the time less. I love that. And obviously, when we say, going to the barbell, I use that as a way to kind of speak to any kind of strength exercise. I'm not saying that barbell is particularly, just for my
yeah.
autistic ladies listening, I'm not saying exactly the barbell,
Yes.
just using that as a context
Yeah.
around strength and training in the gyms. Before we finish up, because obviously want to kind of round out this conversation, we could do this all day. I know that you saw me recently speaking on my socials about GLP-1 medications and Ozempic and all of the things like that. What are your thoughts on the use of these drugs, and not just the use, the normalization of these drugs in such a short time?
I think it's been scary to watch how quickly they've been popularized, how much they have been accepted and not questioned, and how they've almost been marketed from a place that I would say is kind of unclean. Like there is people preying on a lot of people's insecurities, making money off these drugs. I understand that they also have given opportunity and, health benefit and, a lot of people, a lot of positive things too. But I think if we're going to go down this path, we need to make sure that the people that are engaging in them have the base level knowledge of A, what's happening to their body, what is happening in their hormonal pathways that could be influencing them mentally and physically outside of just the weight loss conversation, the pleasure center conversation, the food, like all of the different things that are happening that people don't actually realize is part of the picture, as well as support from a behavioral and nutritional lens. If
Which is
you
not your GP.
No, and you know, unfortunately, people are taking GLP-1s without understanding what their protein intake needs to be like. Without understanding it, if they are not resistance training, they are effectively losing muscle tissue. And once again, this comes back to the conversation we've said already about health and longevity. For a lot of people, it may prompt an initial period of weight loss and, motivation. But what happens when this is no longer something that you're using? Because the long-term behavior change ideally should be addressed at the same time, and that's really hard to do. So it's a scary time. We obviously haven't got long-term case studies or information. We've only got the very kind of like recent clinical trials and associated information with that. So I think that the way I see my role as a strength coach who does work with women and men who take these medications is my job is to help bridge those gaps. So I need to be having those conversations. I've tried to educate myself the best that I can. I'm not coming at it from a place of judgment, but I'm coming at it from a place of, I respect your choice and I'm going to do everything I can to help you be educated in the choice that you've made.
Mm. Which exactly comes back to this matriarchal, community centered care, not this top down or standover or power over of like, I'm the doctor and I'm telling you what to do. Because, yeah, we've got women in long game who are on things like Monjaro, and so many of the entry conversations into long game are, my doctor has suggested this, but I wanted to reach out to you and see if you and I could work together before I go down that path. Or as a, like, I'm going to try not go down that path and I want to focus on my health and my fitness first. I got a lot of flack in the comments of my reel the other day where I was talking about it. And it did reflect to me, and I feel like it doesn't matter how many times we say, like, I don't judge your choices, but I want you to be empowered and educated in your choices. But how many women were commenting on that reel saying, well, I'm going to listen to my GP instead of listen to you? It's like, do people actually understand how much nutritional education GPs have? Or if their nutritional education is actually up to date, or
Yeah.
whether or not they have the time to spend with you in your 10-minute consultation to be like, okay, so here's how you need to eat. And then on the other side of that, going back to TikTok, I was seeing the most disastrous, diabolical advertising, the kind patches, which I now get advertised on Instagram all the time, just so you know, they don't fucking work. There's so much research out to say that a topical patch is not going to make you lose weight. But seeing people advertise these, like a very thin man, not even a muscular man, but thin man, sticking one on saying, my doctor said I was too skinny for the injections, so I'm using these. Or even another one where it's a man sticking one on his girlfriend while she's asleep, and then cut to another clip where he's asking if she wants a cookie and she kind of looks a bit confused and goes, no, I don't really feel like it. I'm like, I'm sorry, you've just literally, that is medical assault, and you're advertising your patches in this way, thinking it's funny and cute and like, oh, it's just a lol. It's just, yeah. On the one hand, I totally agree with the idea that, like, yes, there may be long-term complications and risks that
Yeah.
you might experience 20 years down the track. But if you didn't have 20 years because of the issues that you're facing now with regards to your size, then I see the benefits. But yeah, I'm with you. Like, the lack of evidence, the lack of long term clinical trials, the fact that, there's companies that are kind of bypassing rules,
Yeah.
regulations, industry standards, and selling all manner of weird and wonderful fat loss solutions is just, it's so frustrating because, to be honest, like, the thing that works is actually really simple.
Yeah.
Eat
And that's why it's not
whole food,
sexy. Yeah.
move your body, and look at the way you speak to yourself. Like, it's not rocket science, but we want that complex dopamine seeking. We want the solution to be really, really hard won, because then that justifies to us why we needed to take so long to get there. It's just makes my 20-year-old eating disordered self very sad to see all of these kind of come back around again.
Yes, it's we've seen it before with things like Duramine and, the accessibility ease in which things like that were prescribed. And this is just, obviously very different mechanism, but similar stories that we ideally, like, I guess my mission as a strength coach is, okay, ideally I want to give you everything I can so that that's not where we need to go.
I love how people turn and look at women like us and be like, stay in your own lane. Who are you to comment? Like, dude, this is my whole existence. My whole life is centered around making sure women understand how to be in a relationship with their body. This is my lane. This is
Yes.
my entire lane. I always like to finish these conversations with the same question. So, obviously, the podcast is called Disgustingly Easy. And to me, that is how we need to think about health and think about fitness, and always have this perspective of, like, it's easy. It's actually literally quite easy. And when we can reframe that, it changes how we approach and our perspective. So, if someone is listening to this or watching this and feeling inspired by this conversation, but also feeling really overwhelmed about where to start on their health and fitness journey, what would you say is the one way they could improve their strength or their relationship with their body? One disgustingly easy thing they could do, like, straight away.
I would say the one disgustingly easy action is put your phone away, take off your shoes, go put your feet on the grass and be with yourself for 5 minutes in
Mm,
silence. You don't even need to do anything to do that. But I think just that space for self-connection, the space to slow down, the space to just breathe and be in nature for, you know, a small period of time can just unlock so much within yourself and give you this moment to catch your breath before you then start making choices and jump into your day.
yeah. I love that as a way of, like, that's how you know what's next. Not by searching, 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 or looking at all the information or finding all the things. That's how you know what you want. You need to be in a place where your mind can be clear enough to go, hey, this is what you haven't been looking to. This is where we need to send our focus or our priority. This is what I need from a body perspective. So I love that. Katie, thank you so much for coming on and having this conversation. I just so appreciate women experts, practitioners who are willing to question some of the more dominant cultural narratives around our bodies, around pain, around health, because truth is most people are navigating this space with so much confusion and mixed messaging. If people want to follow your work or learn more about what you do, even check out the gym or your clinic, where can they find you?
Instagram is probably the easiest place to connect. I'm Dr. Caity Hanover. Katie is Caity, bit of a rogue one. But my gym is Melbourne West Barbell Club. So we are in Altona North in Melbourne, and my clinic is inside my gym. So if you want to ever see me there, you can book through that same.
Amazing. Well, I'll make sure all of that's in the show notes. And for everyone listening, if this episode sparked something for you, make sure to bring the conversation over to Instagram, tag us in your stories, share the episode, send it to your friends. And let's just make sure that every single woman out there has at least someone on their feed sharing the countercultural, fuck the patriarchy, anti-diet, anti-paternalistic, anti-shrinking, pro-strength message. Because when more of us share it, more of us are going to see it, and it becomes a more normal and dominant perspective. And of course, as always, remember, when nothing is certain, anything is possible. You've got this, and we've got you.